What types of colectomy surgery are there for colorectal cancer? Imagine your colon as a long, winding highway that sometimes needs repairs when cancer shows up. Colectomy surgery is like taking out the damaged stretch to keep everything running smoothly. The specific type of surgery depends on where the cancer is located, how big it is, and how far it has spread. One common approach is the partial colectomy, also called a segmental resection. This involves removing just the part of the colon that contains the tumor along with nearby lymph nodes to check for spread. For example, a right hemicolectomy removes the right side of the colon, which is called the ascending colon. The small intestine is then connected to the remaining part of the colon. On the other hand, a left hemicolectomy takes out the left side, known as the descending colon, connecting the remaining colon to the small intestine. If the cancer is in the sigmoid colon, the sigmoid colectomy is performed, removing that S-shaped section near the rectum. When the tumor is close to the rectum, a low anterior resection might be done, removing part of the sigmoid colon and some of the rectum, then attaching the remaining colon to the rectum. Sometimes, a larger removal is needed, called a subtotal colectomy. This takes out most of the colon, usually both the ascending and descending parts, leaving the rectum intact. The small intestine is then connected to the remaining colon or rectum. This approach might requiring a temporary or permanent opening on the abdomen, called an ostomy, to allow waste to exit the body. In more extensive cases, a total colectomy is performed, removing the entire colon. This is less common and usually reserved for widespread disease or genetic conditions like familial adenomatous polyposis. After a total colectomy, the small intestine is connected directly to the rectum, or an ostomy is created. For very low rectal cancers, a surgery called abdominoperineal resection is often performed. This involves removing the rectum and anus, which means the patient will need a permanent colostomy, where waste exits through an opening in the abdomen into a pouch. Surgeons can perform these procedures using different methods. Open colectomy involves a large incision in the abdomen, giving direct access to the colon. Laparoscopic colectomy uses several small incisions, a camera, and tiny instruments to do the surgery minimally invasively. Robotic-assisted surgery is similar to laparoscopy but uses robotic technology to give the surgeon more precision. Choosing between these options depends on the tumor size and location, the patient's overall health, and the surgeon's expertise. During any colectomy for cancer, removing nearby lymph nodes is standard practice to check for cancer spread. Sometimes, if the bowel cannot be reconnected immediately, a temporary or permanent ostomy may be necessary. The goal of all these surgeries is to remove the cancer effectively while preserving as much normal bowel function as possible. If you or someone you know is facing this surgery, it's important to discuss all options with a healthcare team to find the best approach tailored to the specific situation.